Good evening. This is Indiana's first full day under the stay-at-home order. We'll get to that in just a moment, but first, our newscast will look a little different for you tonight. Anne Marie is co-anchoring from her house. We're doing our part, of course, to have as many staff members of Channel 13 staying at home. Good to see you, my friend. But let's get our viewers caught up right now on the latest at 5 o'clock. The Indiana State Health Department now confirming 112 new positive cases of COVID-19. We have a total of 477 positive cases across Indiana and 14 deaths. The number of people getting tested in our state is growing every day. We're now up to more than 3,300. Well, Indiana's hospitals say they need more equipment to handle the surge of patients expected over the next couple of weeks. Tonight, our Dustin Grove learned what they're doing to prepare and the items they still need.
Across the country and here at home, as more patients head to the hospital with COVID-19, intensive care units are making do with what they have. At IU Health, the state's largest hospital system, masks and other personal protective equipment, or PPEs, are in very short supply.
Those supplies, we do need to see them start to be delivered.
So they have not been delivered yet?
We have received supplies from the state in small quantities, and we're told there are more behind that.
Hospitals are also working to find more ventilators, collecting them from other clinics and outpatient surgery centers to be used in the intensive care unit for coronavirus patients. And they're getting creative so machines can be shared.
Even things that are 3D printed, but essentially a split that would make one ventilator used for 2 patients possibly.
Do you have a firm number on how many that you need or how many more you need at this point?
We have a very firm number on what we have in inventory, and we have a firm number on how many we'll have ready to be used for patients over the next 2 weeks. Beyond that, it's our planning for what we actually see in terms of the progression of the disease. So I can't say today that we have enough ventilators. I don't know. We won't know until we see the progression of the disease.
We also spoke with the president of the Indiana Hospital Association. Are Indiana hospitals adequately prepared for the potential surge in the coming weeks?
I think we're as prepared as we can be. There's a lot about this virus that's new. Do I think we have enough for some of the more pessimistic models? No, and I think the federal government right now, and look at some of their actions, is taking a lot of steps to try to increase that supply.
Hospitals hoping more of those supplies now get here. And doctors say the most important thing they need right now is for you to stay home. They can't stress enough the importance of staying out of the public. That way, that'll keep the spread down, so they'll have enough hands, enough gloves, enough ventilators, enough everything that they need to treat the people who are sick. Back to you.
All right, Dustin, thank you so much. Governor Eric Holcomb today seemed pretty excited about the number of Hoosiers stepping up to make masks and ventilators during this outbreak. Our Rich Van Wyk was at the news conference and joins us live tonight at 5 to explain what else the state is doing. Rich?
Well, Scott, more than 100 new COVID cases confirmed overnight. 2 additional deaths lost to the disease. These numbers are discouraging. Behind them, today we found out there is some encouraging news. We've been hearing about the plight of healthcare workers and the lack of personal protection equipment they're having out there. Well, the Indiana National Guard, as it turns out, is back to work, sorting out 4 or 5 truckloads of face masks, hoods, gloves, gowns, and other equipment. It was shipped over the last couple of days from the National Strategic Stockpile.
We are in the process of putting that all together, picking it, getting it ready, and actually today are getting that out to some of our hospital systems, especially in local health departments that needed that.
This is the second shipment to reach Indiana. Hospitals are also getting help from unlikely places. Remember high school, all the science labs and healthcare classes? Superintendent of Public Instruction, Jennifer McCormick.
Our schools, whether it's science labs or career technical education, have signaled to us that we have gloves, we have masks, we have gowns. Where do you need them? So our team is working with the Emergency Operations Center to determine what that distribution looks like.
According to the state health commissioner, some hospitals are in good enough shape right now that they didn't need their second shipment right away. But Dr. Box quickly pointed out that that could change at any time. Indiana is still very early stages of its fight with COVID-19. Scott?
Rich, thank you. Ann?
We also learned today the Marion County Coroner has made some pretty serious changes because of COVID-19. And one of the major changes that we learned about right now does include 3 refrigerated trailers that they've ordered as part of temporary storage for bodies if necessary. These trailers, we learn, are connected to a power generator. As Steve Jefferson shows us now, the coroner is really doing her best to try to keep not only her workers and her own family safe as coronavirus continues to spread.
We try to dab on it. You know, you want to cough into your arm. Don't cough into your hand.
As Marion County Coroner, Dr. Leandra Sloan demonstrated best coughing practices over Skype. She urged people to stay home to help stop COVID-19.
Yes, it may feel like you're going crazy. Yes, it may feel like you're going bonkers, but maybe you play games with your kids. You guys TikTok, you guys dance, you read a book, something, but you need to stay at home.
Sloan is also a mother to 3 sons, keeping them safe from the virus too.
We're trying to interact more, just going old school. I've always had board games for my kids, so that's where we're going, playing games, playing cards.
As an IU health physician, Sloan conducts virtual appointments now to lower risk of exposure. And as the coroner, she's responsible for lowering the risk at the morgue too, especially to the public.
You have to pick up belongings. You may have to identify a decedent. And that's important, but we also want to keep you all safe as well as ourselves.
Part of keeping the Marion County Coroner's Office safe is keeping up with the coronavirus deaths in Marion County and the testing. Sloan says out of 13 tests on people who passed away, they've been told 6 people tested positive. 5 are suspected cases, and they're still waiting on 2 results.
If it is a suspected case and it hasn't been proven yet, we are testing. And if we are testing, there are measures we have to do, like use a negative pressure room for the actual exam.
Sloan hopes more than anything that everyone does their part to help stop corona in its tracks.
But you can't look at someone and tell whether they have coronavirus. So the best thing is to really heed the advice that has been put out, which is 1, stay at home.
Yes, stay at home. And, you know, the governor's order to have people stay at home right now is delaying things for students at IU in Bloomington. They had planned to move out of their dorms, but we've now heard from a spokesperson with the university now saying that students need to reschedule the appointments that they had for moving out, and they need to set up a new date. In the meantime, IU continuing to do classes online. This all an effort to keep students safe as well as educated. And a big change up at Lafayette, too. Look at this. This is Purdue University's campus. Usually on a day like today, a beautiful day with blue skies and the sun out, we would expect to see students going to class today. But instead, we see this, an empty walkway by Memorial Mall. No one near the archway there. No cars, no bikes along State Street. Purdue and IU have shifted all of their classes to online.